Hi, my name's Phil. I like talking about politics, and in this video I like to discuss how Labour think their main line of attack against Reform UK should be on the NHS platform. Reform UK's leaders are known to be in favour of scrapping the NHS in favour of an American-style private insurance model, the worst healthcare system in the developed world, and what's more, Farage hasn't even been dialling his views down in his attempt to broaden his party's appeal. He has, yet again, been talking about wanting a private insurance model. But first, for daily political commentary, please hit the subscribe button so you stay notified. So back in the heady days of 2019, Nigel Farage was filmed saying we should have a fully privatised private insurance healthcare system. This is the one which, in America, leads to hundreds of thousands of people a year becoming bankrupt through illness or injury. Because whatever level of cover they have, which for many Americans is none at all, doesn't cover what's just happened to them. And more recently, Farage was talking about maybe using the French model. But don't be fooled again. Remember how in 2016 he was all about, the Norwegian model or the Swiss model for Brexit. Yeah, it took him about 3 microseconds to drop that idea once the result was in. Oh, no, we don't want any of that. No. Same's going to happen here. What he wants is the fully privatised version which America has, as he described in 2019, which would mean millions of people in Britain simply not being able to have access to healthcare because they can't afford it. I mean, look at the situation we have. With dentistry in England, at least, there just aren't enough dentists. And so even though NHS dental treatment is in theory available, if you can't find an NHS dentist to register with, you can't access it. And lots can't. This has resulted in people, including children, developing such serious problems with their gums or teeth that it's got to the point where they've had to go to accident and emergency in hospital. It's resulted in people having to pull their own teeth with pliers. It's a national scandal. Now imagine this same scenario with all healthcare. Not just your gob, your entire body. Imagine having to pay £20,000 to have your baby delivered. Who can afford that? No, many would have to deliver it themselves and just hope there were no complications. This would kill people. And although this is the system Farage really wants, and is what he says when he doesn't know he's been recorded, even the French system would not be appealing to many Reform voters. The number one issue which motivated people to vote Reform UK is, of course, immigration. In fact, More in Common have been doing some surveys of people who voted Labour last year but have since flipped to other parties. The ones who have gone to Reform have done so over immigration. But many Reform voters also value good public services and, like most of the country, really prize the NHS. In fact, if voters had known what the Tories were doing to the NHS, they would have lost power a long time before they did. All people really pay attention to are waiting list figures and how easy it is to get access to a doctor when they need it. So Labour now plan to attack Reform UK on their aims to destroy the NHS. There's footage of both Nigel Farage and Rupert Lowe talking in favour of privatised healthcare. In America in 2023, the average cost per month for health insurance was just under £600. That's the average. There are different levels. The lowest level of cover worked out at about £400 per month, which is still out of reach for millions. And that's per person, by the way. That's not your family. That's not your household. That's per person. Now, there's a bit of a correlation between Reform UK voters and people on low incomes, isn't there? How many would really vote for Reform UK if they realised that Nigel Farage as Prime Minister would want them to find an extra £400 a month per person for the lowest level of cover because the NHS is going? Farage wants his voters to pay hundreds of pounds a month extra for worse access to healthcare. Well, there are millions of people who are living hand to mouth as it is. How are they going to afford that? The usual Tory lies say, but think of the taxes you'll save. You won't be saving the taxes. They won't be saving £400 a month, will they? If they're working full time on the minimum wage, they're paying at the moment £200 a month on all taxes, total tax bill. Never mind just the taxes that go towards the NHS. No, this is a system which only benefits those who pay privately anyway. And actually, I would say even the American system is so overpriced that even the millionaires get a shit deal. Unless, of course, they have so many shares in health insurance companies that their returns exceed their own medical bills. Because those are the only people who benefit, those who own the insurance companies. So if Labour think that this is the way to take Reform UK head on, There are a lot of advantages to it. First of all, many Reform voters would be horrified at the prospect of needing private insurance to get healthcare. Even the French system would mean having to pay more for less. But if Labour can show that Farage really wants the America system, which he will deny outright, but we've got footage, then jackpot. Of course, that would require Labour to get a lot better at getting their message through to the public. The mainstream media is not going to help them out on this one, because they want it too. In fact, for this strategy to work really well, I do think, and you know what I'm going to say, Labour must better utilise social media. That is my main concern with this strategy. They're showing no signs of understanding how to get a message directly to the public yet. But it is still a good line to take, especially as Labour will certainly provably be improving access to the NHS before the next election. There are a lot of challenges and they will cock some things up, but the waiting list, you know what, they're going to come tumbling down by the election. They're on much weaker ground on immigration, especially as they're not taking the small boat crossing seriously. And because asylum is always amplified in the media, makes little difference what happens to overall immigration numbers. They don't deal with asylum, they have nothing to fight with Reform with. And until they realise they need a system of claiming asylum, which is at least easier than getting into a dodgy boat, they won't be dealing with it. So refusal to work on safe routes, at least in France, does mean that Labour have basically abandoned fighting on the immigration platform, at least with Reform UK. So the NHS, yeah, that is a good line to take. It's something the general population values. And Reform UK voters, absolutely no exception. Nigel Farage does want to get rid of it. We can prove that. We've got videos of him saying it. And now he's kindly carried out an interview with LBC where, again, he said he's open to anything, including a private insurance model, which sounds quite vague, but, you stitch in what he said in 2019 when he didn't think he needed to be quite so guarded. And you potentially have a very good line. I actually don't know why Labour didn't stitch in that 2019 clip as part of their campaign. Maybe they will. And you may think that because the top issue for Reform voters and Labour to Reform switchers is immigration, that this is a less useful line of attack. Yes, that's true. It would be better if they took away the visible signs of the forms of immigration which offend those voters. But when it comes down to it, many people who say immigration is their top issue can still change their mind if they think the NHS is threatened. After all, one of the main lines the likes of Farage uses to get people to think immigration is such a top issue is the false claim that it makes it harder to get access to healthcare. Doesn't, of course. The percentage of immigrants working in the NHS is greater than the number of patients in the NHS, which means that lowering immigration makes it harder, not easier, to get a doctor. To say nothing of the fact that immigrants also pay more for the NHS than a UK citizen. But do you know what would make it even harder to get a doctor? Having to pay £400 a month for the most basic level of cover and £600 a month for the average level of cover. That doesn't cover everything. For people who cannot even afford £40 a month. And Labour should hammer that side of it as well. Don't just push the line that Farage wants to privatise the NHS. That's not enough. Make it clear exactly what that means in terms of people's personal finances. But there we are. Those are my thoughts. Let me know yours in the comments below. If you've enjoyed the video, please click the like button and subscribe for further content. If you'd like to support the channel further, you can click the join button for memberships. Thanks for watching, and until next time, I'll see you later.